Hello guys, today's video is going to be very special for the medical students, house officers and for the medical officers out there. Because in this video I am going to talk on a very important aspect of medical consultation, which is history taking. So I am going to teach you the history taking skills in UK style. This whole structure is basically designed by a renowned doctor, Dr. Muhammad Sobe, who is basically a tutor of PLAB 2 exam in UK. But before starting the history, you must introduce yourself to the patient. Like in a hospital setting, you can say, "Hello, my name is Dr. Zaid. I'm one of the doctors over here. How can I help you today?" So let's get started. This whole structure is basically divided into four parts. That is P1, P2, P3, and P4. I have made an easy way to memorize all these steps. That is rule of right hand. As you can see, my two fingers represent the P1, my middle finger represents the P2, my index finger represents the P3 and my thumb represents the P4. I have divided P1 into 6 components 1, 2, 3, 4, 5, 6. P2 into 2 components 1, 2. P3 into 2 components 1, 2 and P4 into 4 components. Now let's explore the P1. The first box of the little finger represents the P, which stands for presenting complaint. To explore the presenting complaint, it is basically divided into three parts. If the patient presents to you with pain in any part of the body, then you can use a mnemonic Socrates. If patient presents with discharge, then you can use a mnemonic track. Or if patient has any other complaint, then you can use a mnemonic Odipara. For pain, you can ask the site, onset, character, radiation, alleviating factors, timing, exacerbating factors, and the severity of the pain. If the patient complains of discharge from any part of the body, that is vomiting, diarrhea, bleeding, or sputum, then you can use the mnemonic track. Track stands for timing, like how many times did the discharge happen, relation with anything, amount of that discharge, and color of that discharge. And besides these, if the patient has any other complaint, then you can use the mnemonic ODPARA, which is onset, duration, intensity, progression, aggravating factors, relieving factors, and associated factors of that complaint. The other two boxes of little finger has A, which is associated symptoms, and C, which is the concern. You can ask the patient for any associated symptom. For example, if the patient has chest pain, you can ask for shortness of breath, orthopnea, and PND. You must also ask the patient concern and worry if he is suspecting something serious about his presenting complaint. Ring finger has three alphabets: D for differentials, R for risk factors, and F for flaws. Based on the presenting complaint, you make some differentials in your mind. Then you ask the risk factor related to that differentials. And lastly, you also ask for the flaws, which is fever, any lumps and bumps, appetite loss, weight loss, and sweating. Now let's discuss the P2. P2 has two components. First is past history of the presenting complaint and other is past medical history. In the first component, you ask the patient if she or he had the similar complaints in the past. And the second component, you ask if they had any past medical condition like hypertension, diabetes, etc. P3 also has two very important components. The first one is DESA, in which you ask the patient about his diet, exercise, smoking and sexual history, and alcoholism. The second component is MAFTOSA, in which you ask the patient about any past medication, any allergies, family history, travel history, occupational history, social history, and anything else he wants to tell you. If your patient is a female, then you can add P4 to the history, in which you can ask if she is on any kind of contraception, if she is pregnant, or if she has any problem with her periods, and what about her pap smear. You can remember it as 4 P's like pill, pregnancy, periods, and pap smear.